Welcome back. Africa 54 health correspondent Linord Moudou joins us now with a look at antibiotics resistance. Linord.
In a new study, the World Health Organization says an increasing number of infections are no longer treatable because of growing antimicrobial resistance. The WHO study found that no region in the world is prepared to combat this serious global threat, risking the lives of millions of people. Only 25% of the 133 countries have a comprehensive plan to fight resistance to antibiotics and other antimicrobial medicines. The survey also finds public awareness of the issue remains generally low, and many people believe antibiotics are effective against viral infections. It says this leads to antibiotics being used when they are not required or effective, which can lead to resistance. AIDS is taking a toll on the Kingdom of Lesotho. Its combination with poverty has caused a life expectancy to drop, and the impact on the population is getting worse as the country's residents are becoming too sick to work. Observers say the situation is alarming and more needs to be done. Dr. Majaliwa Marwa is program specialist for HIV UNFPA Lesotho.
Lesotho is among the countries with highest prevalence in the world. At 23%, it has the second highest prevalence in the world. And the prevalence is higher even among women. Across all age groups, women have higher HIV prevalence than men in this country. For the last 10 years, according to the Demographic Health Survey, this situation has not changed. Women are more affected due to several reasons, one of it being unequal power relationship, and also beside the biological factors, but women in this country are faced with gender-based violence, are also faced with unemployment, are also faced with unequal power relationship within the households. These are some of the reasons that are structural reasons that are perpetuating the prevalence among women.
And we'll take a closer look at the HIV/AIDS crisis in Lesotho in our next health report. Now, a new study says the likelihood of being bitten by mosquitoes could be down to genes that control our body odor. In the preliminary study published in the medical journal PLOS, scientists from the UK and the US enlisted 19 non-identical and 18 identical pairs of twins in a pilot study, and their odors were submitted to mosquitoes with their hands. Identical twins were more likely to have similar levels of attractiveness as opposed to non-identical twins, where results were more varied, suggesting shared genetics factors were at play. Experts say the intriguing results must now be assessed in larger trials. Now, malaria is a threat for over 90% of Nigeria's 177 million people, and it's the leading cause of child death in the country. While the UN says there has been a sharp decrease in malarial prevalence due to interventions like the mass distribution of insecticide-treated nets, lack of information and poor quality drugs are still pose a major challenge. Caleb Oguche is recovering from malaria, a treatable parasitic disease that kills 600,000 people around the world every year. Most victims are children under age 5 living in the poorest parts of sub-Saharan Africa. UNICEF says over 300,000 Nigerians die from malaria annually. Oguche, a Lagos-based accountant, has been out of work for 3 days receiving treatment.
I think malaria is it's something that happens frequently to persons within this region of the world, and it's actually not a good experience. The feverish nature, one always being weak, and then having to cope with headache.
Malaria is caused by the parasite Plasmodium falciparum, which is spread by mosquitoes. Experts say one of the most challenging features of this parasite is its ability to evolve and overcome antimalarial drugs. This factor is undermining global work towards eradicating the killer disease. Protection through the various other interventions like use of mosquito nets as well as indoor spraying are vital in stopping the recurrence of the disease even where drugs have worked. Alexander Wamai is a doctor in Lagos.
What you find most times is that the patient comes, you make a diagnosis of malaria, it is confirmed by your laboratory, and then you give a course of anti-malarial drugs. Of course, the patient gets cured, but the patient returns back to her environment where the mosquitoes continue to bite them again. So you expect that in another 2 weeks to 4 weeks, this same patient who was treated will come back again. So the idea is that you must break that chain of regularly getting yourself exposed to mosquitoes.
Nigeria is working to meet the Millennium Development Goal of halting the incidence of malaria and other major diseases by 2015.
Unfortunately, Nigeria is not amongst the 4 countries where malaria has been eliminated, and then we are not amongst the 47 countries that are about to achieve the MDG goals of reducing the burden of malaria by 75% this year. However, I know that there are concerted government efforts to ensure that the post-2015 strategies for eliminating malaria has been adopted fully by the Nigerian government.
Medical experts have long hoped scientists will be able to develop an effective malaria vaccine. The malaria vaccine, RTSS, developed by British drug maker GlaxoSmithKline, is the first to reach the final clinical trial stage. Data shows it offers partial protection to children for up to 4 years. That's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks a lot, and be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.